We've all been there.
That dull ache or sharp throb that suddenly disrupts your day and makes focusing nearly impossible. Headaches are one of the most common medical complaints globally, yet they remain one of the most misunderstood conditions in modern health. But what exactly is happening inside? Today, we are exploring the different types and causes of headaches to help you understand your symptoms. Medical professionals generally categorize headaches into two main groups, primary and secondary. Understanding this distinction is crucial for proper treatment. Let us start with secondary headaches. These are not the problem themselves. Rather, they are symptoms of another underlying health issue. One of the most frequent causes is simple dehydration. When your body lacks fluids, brain tissue can temporarily shrink, pulling away from the skull. Secondary headaches can also result from physical injuries or sinus infections, where inflammation creates intense pressure within the facial cavities. Now let us dive into primary headaches. Unlike secondary ones, these are independent conditions where the headache itself is the main issue. The most common primary type is the tension headache. It often feels like a tight band is being squeezed around your forehead. Then there are migraines. These are far more than just bad headaches. They are complex neurological events often accompanied by sensory disturbances. Sufferers often experience extreme sensitivity to light and sound, often needing to retreat into a dark, quiet room to find any relief. Less common but much more intense are cluster headaches. These occur in cyclical patterns or clusters and cause severe pain around one eye. Science still does not fully understand why primary headaches occur, but we do know they involve signals between the brain and blood vessels. Various lifestyle factors can act as triggers. Stress, irregular sleep patterns, and even changes in the weather can set off a painful episode. For many, identifying these triggers is the key to prevention. Keeping a headache diary can help track patterns over several weeks. If your headaches are frequent or changing in nature, it is essential to consult a healthcare professional to rule out serious underlying causes. In summary, remember the difference. A primary headache is the condition, while a secondary headache is a symptom of something else. Managing your health starts with knowledge. By understanding your triggers and the nature of your pain, you can move toward a life with more clarity. Always seek professional medical advice for persistent pain. Thank you for joining us and learning about the science of headaches. Understanding the specific type of headache you are experiencing is the first crucial step toward effective management and finding lasting relief. Up next, we will break down the three classifications of headaches: tension type, migraines, and the intense cluster headaches. Let us begin with the most prevalent form, the tension headache. Nearly 80% of adults will experience these periodically throughout their year. Tension headaches are often described as a dull, aching sensation that feels like a tight band is being squeezed around your entire forehead. The pain is typically bilateral, meaning it affects both sides of the head simultaneously, and can last from 30 minutes to several days. Common triggers include high levels of stress, poor posture, or long hours spent staring at digital screens, leading to muscle strain. Moving to our second category, the migraine. This is not just a bad headache, but a complex neurological condition with debilitating symptoms. Migraines are characterized by intense, throbbing pain, usually concentrated on one side of the head, often accompanied by nausea and light sensitivity. Some migraine sufferers experience an aura before the pain begins, visual disturbances like flashing lights, zigzag lines, or temporary blind spots. These attacks can last anywhere from 4 to 72 hours, making it nearly impossible for the individual to perform daily tasks. The perhaps most severe type is the cluster headache. These are rare but known for their excruciating, piercing intensity. Cluster headaches occur in cyclical patterns or clusters, often waking a person in the middle of the night with sharp pain behind one eye. Symptoms include a drooping eyelid, redness, or tearing in the affected eye, and even nasal congestion on that same side of the face. Unlike migraines, which may cause a person to lie still, cluster headaches often cause restlessness due to the sheer level of discomfort. To summarize, tension headaches are a dull squeeze, migraines are a throbbing pulse with sensitivity, and cluster headaches are a sharp localized attack. While most headaches are manageable, it is vital to seek medical professional advice if you experience sudden, severe pain or changes in headache patterns. Almost everyone experiences a headache at some point. But understanding the specific type and the right treatment is essential for long-term health and relief. For common, occasional headaches, Over-the-counter relief is often the first line of defense many of us turn to for quick results. Managing tension headaches doesn't always require medication. Simple steps like hydration and environmental changes can be incredibly effective. Resting in a quiet, dimly lit room helps reduce sensory input, allowing the nervous system to calm down and the tension to dissipate. However, migraines are far more complex. They are often characterized by pulsing light sensitivity and intense, throbbing pain that can be debilitating. When headaches become frequent or severe, it's time to move from home care to a clinical environment for a professional diagnosis. A physician can use high-resolution brain scans to investigate the underlying causes of complex symptoms, ensuring nothing serious is being overlooked. Long-term management also involves lifestyle changes. Taking a peaceful walk outdoors can lower stress levels, a common trigger for many types of headaches. Nutrition plays a vital role too. A balanced meal rich in vitamins and minerals helps maintain stable blood sugar and prevents trigger-related pains. Staying organized and reducing daily chaos can further minimize the psychological stress that often manifests as physical head pain. Always remember that your health is a priority. If you experience persistent issues, seek professional medical advice to find a sustainable solution. Thank you for watching. Like and subscribe to the channel so you don't miss out on many more interesting and useful health videos.